My name is Susan White. I'm a psychologist at the University of Alabama, and I direct the Center for Youth Development and Intervention. This video is part of a collaboration between Autism Society of Alabama and the Alabama Regional Autism Network. Today I'm going to be talking to you about encouraging socially appropriate behavior in teenagers. Some of the content might also be appropriate for young adults and for children who have autism spectrum disorder. One thing that's a common challenge that parents face is helping their kids know when it's appropriate and inappropriate to undress themselves or take off their own clothing. What I suggest to parents in this situation is first identify safe places. Where is it appropriate to take your clothes off? One very simple rule is only in your own bedroom. It can get more complex and a little bit more nuanced as kids get older. When they might have to use the locker room at school before PE or at the doctor's office. So considering nuances and considering different social stories about when it might be safe in this situation to take off your clothes. I also find it can be really helpful to go over a couple situations that it's never appropriate to send pictures of oneself or take off clothing when somebody other than your parent or your pediatrician asks you to, and to be cautious of possible online victimization, again, with sending inappropriate pictures. Some parents find visual props such as these or social stories, like I said earlier, very helpful in terms of why it is important to practice personal hygiene, nail grooming, use deodorant, that type of thing. Again, this is not a social story per se, but some of these visuals are very readily found online. Prevention is, in this case, often termed stimulus control for public undressing. Some of the very basic yet often overlooked things that we can do are clothing adjustments. So things like using a belt, even if it's with joggers, okay, even if it's with pants that don't have loops, cuffed pants, cuffed sleeves, button-down shirts, dressing in layers, tight socks. There are lots of different things that can be done to add in a little bit of barrier that will require pause and more time to undress. And knowing what the triggers are to a person getting undressed when they shouldn't, if it's discomfort or feeling constricted in the clothing or self-stimulation. So if we can identify the trigger, then you can know what else can I do for prevention. For example, keeping one's hands occupied, busy, so that they are less likely to reach for their waistband. Moving on now, another concern that a lot of parents of teenagers face is physical appearance and why it matters. And this relates again to personal hygiene. I encourage parents to first make sure that the child understands what we're talking about with physical appearance. Consider doing this too with a mirror in the room. Identify the person's physical characteristics, hair, face, body, just noticing, what does your body look like? You know, how is your nose? Does it have a little bit of a curve to it? What's your hair look like? Is it straight or curly? Your clothing, and with the goal here of developing an appreciation of how your appearance can influence other people's thoughts or feelings about you, their judgments. This can also be done with pictures of other people online or magazines, noticing appearances and what they say about the other person. This is similar to basically teaching a preteen or a teenager how to make a good impression. So this is me, and basically impression management and how you're seen by others. So some biggies that we sometimes need to teach explicitly to our kiddos is what you choose to wear. So this is largely your clothing. Okay, a lot of kids who are on the spectrum have sensory issues that might make it difficult for them to wear tighter fitting clothing with tags, certain fabrics. So setting small goals, like one day a week, no joggers or sweatpants. Grooming and hair, so things like nail length and brushing your teeth, keeping your hair trimmed and out of your eyes. So again, if we can build it into the schedule and set small goals of every Monday, you've got to get your nails trimmed, for instance, that can be useful. It becomes something that is part of the schedule. And hygiene. talking about how frequently you need to bathe, especially as you approach adolescence and your body produces more sweat, and use of deodorant and other cosmetics if it's appropriate. Changes, challenges for people who are on the spectrum. Explaining puberty for parents, I suggest that you start with the most obvious physical changes before going into the more nuanced and internalized changes related to hormones and emotions. So start with things like, oh, you might notice that you're getting taller, or you even have a growth spurt, or you might notice that you start to sweat more. And again, this can be done with the aid of a mirror. A really important consideration is the identification of a safe go-to person for when the inevitable questions come up. So sometimes I think of this as also who not to go to, like your peers at school with questions, but rather mom or dad or an uncle or somebody that is that will give them age-appropriate factual information. Third, discussing uncomfortable things about physical and emotional attraction versus being in love and what the difference is, and in normalizing these feelings that, again, as people, especially as people approach adolescence, they're likely going to feel, and giving names to that. So being attracted to somebody might be different than being in love with that person. Starting with the physical sensations like your heart beating faster, or you might feel nervous or warm. And also starting to pay attention to how to flirt and what others do when they're attracted to a person in an age-appropriate way. I find that sometimes rather than encouraging them to watch people at school and what happens, movies or online content watched together with a parent can be really helpful here. You can even do this with a volume off of just watching the body language, eye contact, that type of thing of what do you think that verbal or that nonverbal message is sending? And then helping the teenager identify personal boundaries. What do they feel comfortable with, and when should they assert themselves? And appreciating other people's boundaries. Sometimes you can go walk through like the game What If, like different scenarios, and help them identify scripts of sorts, or at least practiced responses for how to handle situations that they may encounter, like somebody at school asking to borrow your deodorant, or a stranger sitting too close to you, or if a teacher compliments you on your appearance. Thank you for your attention. There's more resources about this content and other resources, including local mental health services and websites that have evidence-based intervention resources on our website at the Center for Youth Development and Intervention. This is a screenshot of our homepage.